So here the title is Potency of Emotional Freedom Technique on Postpartum Blues and Parenting Stress among post-cesarean section mothers in selected hospitals at Erode. It is purely a partially randomized patient preference study. Introduction. This all just reviews. Okay, so postpartum blues, also known as baby blues and maternal blues, is a very common but self-limited condition that begins shortly after childbirth and can present with a variety of symptoms such as mood swings, irritability, and cheerfulness. The first month postpartum can be challenging for parents, of course, even for father also. So nowadays, research says that even fathers they develop postnatal blues because of the hormonal impact, of course, the what to say, lack of sleep, and all this could be a triggering factor even for the father, leading to elevated symptoms of parenting stress, depression, and anxiety. So in the literature, scientific studies evaluating the effectiveness of emotional freedom technique on depression are included. In addition, with the study, an important step will be taken to include an easy to apply inexpensive therapeutic method, such as pregnancy and postpartum depression treatments, and evidence will be sought to ensure that all professionals dealing with women health, especially midwifery, use this technique. And citation have cited in the year 2020. And hitherto positive nursing literature has abounded on intervention like emotional freedom technique on postpartum blues and parenting stress. Besides, this study focused on hypothetical testing by comparing the potency of emotional freedom technique on postpartum blues and parenting stress among post-cesarean section mothers based on partially randomized patient preference. So this is methodology. After obtaining return informed consent, postpartum cesarean section mothers who fulfill the inclusion criteria like age between 20 and 35 years, primary mothers, from second day of post-operative session, that is post-cesarean session, and moderate to severe level of postpartum blues and parenting stress, because my level doesn't work out because it is self-limiting, it can just vanish away after a few days. That's why I've taken only moderate to severe level of postpartum blues. And we can give consent to participate in the study who can speak, read, and understand Tamil or English. These subjects were recruited and enrolled in my study in selected hospitals at Erode. The design used for the present study was experimental design with partially randomized patient preference. Purpose of sampling technique was used to recruit the study subjects. The total sample size was 150 postpartum cesarean section mothers. All study subjects were asked preference about emotional freedom technique or standard methods of care. So according to their preference, the treatment conditions were allocated. The study subjects without strong preference regarding the treatment conditions alone were randomized, but all subjects were included in the study. Around 75 subjects accepted and they had strong preference towards emotional freedom technique. So just like that, they took the case and they were in that particular group and they were enjoying the emotional freedom technique. And only 45 were willing to take these standard methods of care in the sense control group. And only remaining 30 subjects were randomized by the researcher, in the sense me. I randomized only 30 subjects out of 20 in experimental group and 10 in control group. And all 150 subjects were interviewed before intervention by assessing background variables like age, education, family monthly income, type of family, type of marriage, support system, family history of postpartum blues, complication during delivery, previous history of abortion, and gender of the newborn. So in the second post-cesarean section day, the subjects were assessed for postpartum blues by using Likert IMI Blue Assessment Scale, which consists of 30 items. Every response is rated. The maximum score given for the presence of postpartum blue symptoms and minimum score for the no symptoms. The rating scale consists of 3 responses: present 2, occasionally present 1, and not present 0. And again, parenting stress was measured by adopting parent stress scale, which consists of 18 self-report measures in which parents respond to statements. The possible range of the parent stress scale is 18 low stress and 90 very high stress. Experimental arm received emotional freedom technique. And emotional freedom technique, tapping acupressure points by the into 5 steps, namely step 1, it just include like identify the issues. First, postpartum cesarean section mothers were made to identify postpartum blues and parenting stress. Thus, that was my first step. And second step, just the initial intensity. Post cesarean section mothers were made to set a benchmark level of intensity to postpartum blues and parenting stress. And step 2, the setup. The subjects were acknowledged regarding issues and completely were made to accept. And step 4, it is exact tapping sequence of emotional freedom technique, which focuses on 9 meridian points. Number 1 could be karate chop. It just focuses on intestine meridian, and top of the head, it governs all the vessels, and tapping in ascending order. It starts from right eyebrow, side of the eye, under the nose, chin, beginning of the collarbone, under the arm. The subjects were allowed to verbalize their negative and positive thoughts through while tapping. So certain subjects, they ventilated their negative thoughts, like ill feel towards taking care of the baby, and of course, sleeplessness, and in fact, their food pattern, and etc. have been expressed by the mother. And step 5, just the final intensity. The subjects were made to compare the results with their initial intensity level of postpartum blues and parenting stress. Literally, I followed all the 5 steps for 13 minutes twice a day, morning and evening, for 4 days. So control arm received standard methods of care. You all know the meaning of standard methods of care, I suppose. Standard methods of care in the sense, all the routine care given by the hospital they would have received. And post-test was conducted by using the same assessment techniques in experimental arm and control arm. So results. So paired t-test and unpaired t-test showed statistical significance by scaling down the symptoms of postpartum blues and parenting stress in experimental arm, and comparatively the control arm among post-cesarean section mothers depicted in table 1 and 2. So this is tabular representation of postpartum blues in experimental arm and control arm with pre and post scores with captions and steps. And here in experimental arm, pre-test mean score was 16.1. In experimental arm, a post score was 11.1. In control arm, pre-test score was 15.7. In control arm, post score was 14.8. And paired t-test showed statistical significance in experimental arm, t is equal to 7.38. And in paired t-test in control arm showed statistical non-significance is t is equal to 1.75. And paired t-test between experimental arm and control arm post-test showed statistical significance, t is equal to 6.48. So I figure out the total sample as 150, and in experimental group 95 and control group 55. And this is about parenting stress with captions and stubs in experimental arm and control arm with pre and post scores. And in experimental arm, pre-test mean score was 17.1. In experimental arm, post-test mean score was 13.1. In control arm, pre-test mean score was 16.7, and control arm post-test score was 15.8. And the paired t-test showed statistical significance in experimental arm, t is equal to 8.38. It is very statistically significant. And control arm showed statistical non-significance, t is equal to 2.89. And paired t-test showed statistical significance between experimental arm and control arm, t is equal to 7.16. It is highly significant again. And discussion. The study findings reveal that administration of emotional freedom technique was significant in scaling down the symptoms of postpartum blues and parenting stress. Only one study has been in which emotional freedom technique is applied during pregnancy, and the study is related to the stress and endurance. And citation in the year 2020, and results showed significant proportion of female having postpartum blues. Also, women who had cesarean section and female newborn showed no proportion of depressive features. From the result, it is advisable that screening and intervention should be carried out at the earliest. Citation Pragna Sonari in the year 2015. Since parental distress symptomatology and parenting caregiving quality after birth can affect infant development, citation Murray L. and Theron P. et al. In the 2015, detecting effective ways of intervening in an early stage, thus already during pregnancy is of vital importance for both parents as well as children's health and development. The conclusion, emotional freedom technique was quite effective for curtailing the symptoms of postpartum blues and parenting stress among post-cesarean section mothers. These are some of the citations. Thank you so much for bearing with me. Thank you all. Any queries can be asked right now.